Hello, dear students. Welcome back to I Love Pharmacology. In this session, you're going to see which are all the drug combination that will be very helpful in the treatment of angina. So, angina drug combinations. So, as you know, the most commonly as well as immediately useful drug among anti-anginal group of drugs is the sublingual short-acting nitrates. So, it can be taken as in when need basis. It helps in aborting as well as terminating the anginal attack. So please remember, as soon as the patient experience any pain which may mimic, or if it is due to some cardiovascular pathology which leading to the angina. So in such case, you may have to administer sublingual short acting nitrates, which mainly helps in aborting the anginal attack. And also, this treatment would modify the course of the coronary artery disease. So, thereby, it will help in decreasing the cardiac mortality. So, along with that, you will be giving a other drugs which will have a cardioprotective action. So, which are all those drugs which can be added or given along with the anti-anginal drugs or the antiplatelet agent, statins, as well as the angiotensin converting enzyme inhibitor. So, all these three drugs will provide the cardioprotective action. So, apart from that, the beta blocker, which is also one of the useful anti-anginal drugs, helps in warding off the anginal attack. At the same time, it will going to help in cardioprotective action. So please remember, so what are the three major anti-anginal drugs? Those are nitrates, second is beta blockers, and third is calcium channel blockers. So next, moving on to, let us see what is the efficacy and safety between the nitrates, beta blocker, and the calcium channel blocker. So, if you consider the efficacy and safety with respect to these three drugs, the long acting or long term nitrates, that is glyceryl trinate, is equally efficacious as well as safer compared to the beta blocker. And also, both of these long term nitrates as well as beta blocker are equally efficacious and safer when compared with the long acting calcium channel blocker. So, please remember, although we say the beta blocker and calcium channel blockers, especially the longer acting calcium channel blocker, although both of the drugs provides the survival benefit, the survival benefit as well as reduction in the mortality will be more with the beta blockers when compared to the calcium channel blocker, but the survival benefit will be similar. So initially you can start on with the one of the anti-anginal drugs once you diagnose the patient is having angina pectoris. So you can start with the monotherapy. If the patient does not respond to the monotherapy, or if there is no adequate relief, so you can increase the dose, or you can add 2 or 3 drug combination can be administered together. So usually you will going to combine the beta blocker along with the long acting nitrates. This is the combination that has been rationally approved in the treatment of classical angina. So let us see how they are rational in nature. So nitrates will going to cause tachycardia as a side effect, but beta blocker will block the tachycardia. Whereas the beta blocker will going to cause ventricular dilation, whereas nitrate will going to prevent the ventricular dilation. Whereas beta blocker will going to decrease the total coronary flow, but nitrates will going to oppose this and it will increase the coronary flow. So this is what the reason or rationale for using the beta blocker along with the long acting nitrates in the treatment of classical angina. So next, please remember, you can also use the combination such as the beta blocker and a slow acting dihydropyridines, that is calcium channel blocker, that this can be used in place of nitrates. So either you can use slow acting dihydropyridines, or in that place you can use the nitrates. Especially this is useful when if you are using a beta blocker along with beta blocker, if you are using a slow acting dihydropyridines or nitrates, is very useful in overcoming the coronary vasospasm in case of classical angina. And one more very important combination which you need to avoid is the beta blocker along with the verapamil and diltiazem. Why you need to avoid these combination, that is verapamil, diltiazem along with the beta blocker? The reason being, if you combine these two drugs have similar effect on the heart. That is, they are going to depress the SA node, they are going to depress the AV nodal conduction. Both verapamil as well as the diltiazem and beta blocker will going to decrease the SA nodal conduction, it will decrease the AV nodal conduction. So therefore, both of this two drug combination will be having the depressant effect, which is not useful, or you need to avoid this combination in case of patient who are having angina. So this was about the class on angina, anginal drugs and its combination therapy. So if you find this video useful, please do subscribe to my channel, I Love Pharmacology, and do not forget to share and hit the like button for more updates on interesting topics related to pharmacology. Thank you.